If you've been struggling to write your policies and procedures or to keep up with all the paperwork requirements of your human services business, you've likely been stressing, duplicating efforts, maybe even losing sleep, paying multiple people, and seeing the same lackluster results. And you're wondering what you need to do. I'm Quadria, and I've helped over 250 organizations around the United States start their human services business or support them with compliance to keep their business open. I've helped many new business owners go from stress with so many areas to fix to having peace of mind and smooth operations, from a lack of visibility and referrals to being a go-to in their local area. And the best part is they didn't have to figure it out themselves or do it all alone. I've helped some agencies and programs go from one facility or one bed or location to more than 6 or 7 locations in less than 3 years. Most business owners, they're trying to be successful with their new program, but they start off wrong. They don't really understand the ins and outs of these businesses. They end up sabotaging their results. They do all of this hard work, but then they end up with little to nothing. The truth is, starting these programs without knowing how to run them, it can cause a lack of trust. It can result in you not receiving referrals, and eventually you may even have to pay back money for services that you actually rendered and provided. If you want the right support so you can make faster progress towards success and compliance, you want to have peace of mind and see results, we can help you. Whether you're an owner or operator, you're struggling to keep up, we've got you covered. Today, we're going to uncover some hidden secrets to navigating licensing, some simple strategies that can help you streamline your operations and reduce compliance burdens. And then we're also going to talk a little bit about some common pitfalls we see that can cost you time, money, and your reputation. So first, a few secrets on navigating the complex world of licensing. Licensing can be daunting, but if you understand the challenges, then you can make a difference. Let's say you're a mental health provider. Have a documentation dream team, some dedicated people in your agency who, in addition to the roles they have, they review your records and make sure they're accurate and up to date. Let's say you're a substance use provider. You can maybe focus on certain controlled substance protocols and having a dedicated committee or team that looks through and makes sure that you're counting those controlled substances right, you're tracking them appropriately, and help decrease the room for errors. And an example for a developmental disability provider might be you have some people who are dedicated to completing those person-centered planning tools and making sure that the people in your programs are having inclusion in their communities. When you're working with licensing, it's very important. Take the regulations that they give you and turn them into a checklist if you don't know what to do. That can really help you navigate it instead of you trying to grasp it all and understand it all at one time. Just simply take what it says, look to make sure you're doing a few strategies that can help you streamline your operations and reduce your compliance burden. One effective approach we've seen and we help people with is creating a centralized compliance calendar. One place they can go to track different things like their renewal of their license, any inspections, any training deadlines, basically anything within their program that is time sensitive and requires an action to keep it going. We've seen that be very helpful. Regular staff training programs. So on those key components like HIPAA, compliance, emergency procedures, making sure that you have a set training schedule. Even if you have staff who start at different times, maybe they just came through orientation, you can have them all still be on the same rotation and training calendar every month based on the locations they work or based on the programs they're in. That way you're not trying to track so many different deadlines of a staff who started on the 15th of this month and somebody else who started on another day. It can be a lot. Starting out and when you're smaller, you might be able to navigate it, but as you grow, that's not going to sustain. We also recommend integrating using a platform that can have your documentation, but also some reporting tools so that you don't have to always try to manually catch everything. That can really be a game changer. You might also find and want to utilize some compliance monitoring softwares that can help you, let's say if you're a substance use provider, with tracking that medication inventory and automatically flagging those discrepancies. If you're a developmental disability provider, an example could be that you have a platform that helps you facilitate the communication between your direct support professionals, the support coordinators or planners, case managers, and families or guardians. It may be that you have a shift report that is automatically generated and sent to certain people electronically with key information. All right, let's discuss some pitfalls. The major pitfall we see is incomplete documentation. For example, in most programs in the human services industry, you're following some type of plan, whether it's a treatment plan or an individual support plan. If that person has major status changes and you're not updating that plan, then that means you're not appropriately supporting their needs. And that means that if you're straying away from that plan to address those needs and it wasn't in the agreed upon plan, then you can run into issues with citations and licensing. It's good to have an internal auditing system. Again, dedicate some people who can review your records, all types of files on a routine basis. How often you do it is up to you. You shouldn't wait and do it once a year or even twice a year. These services you're providing are typically daily, weekly, so you should be looking at them. Our recommendation is at least monthly. Um, have good communication with your licensing bodies and your governing bodies. Make sure that they know what's going on. A lot of things are time sensitive, and you're supposed to notify them of certain changes as they occur or within a certain time period of those changes occurring. So again, making sure you're aware of what you should be telling them and when you should be telling them is going to be very key in trying to help you avoid a lot of those pitfalls that we see. Another thing we hope is that you found these insights helpful. While they were quick and brief and just a few examples, they can help you with just trying to get on the right path of navigating licensing, streamlining your operation, and cutting out some of those pitfalls. If you need help with any of those areas you've heard about or other aspects of your program, we help you get started with some quick tips in our ebook. So you can just click the button below to grab that ebook. If you want to see success, revenue, the satisfaction, you want peace of mind to get more sleep, then you want to get started now. You don't want to wait. Time is of the essence. You want to be in compliance, as we say, by choice and not by force. And remember, systems are not optional.